Hey there, and thanks so much for tuning in to another 3-tip bit. I have a super special guest today. She is one of my best friends from college, actually. If you are a good friend of mine, you have heard me brag about her all of the time. So, Joanna, I'm going to go ahead and let you introduce yourself. Tell us who you are, what you do, and who you do it for.
Hi, everyone. Good morning, and thank you so much for having me. It's a pleasure to see your face on a beautiful Friday morning. So my name is Dr. Joanna Green. I'm a general dentist, and I have a strong focus in craniofacial growth and development for our pediatric population. So a lot of you are probably wondering, what does that mean? And so actually, it means we're all about developing the airway. So your airway actually starts at the tip of your nose and goes to about here, which is your epiglottis. And this is the area that brings air into your lungs via your nose or your mouth. So what that means for me is that what I do on a daily basis, I work with infants, releasing tongue ties and lip ties. And in children, it's about being a detective. So we screen for habits like prolonged pacifier use, thumb sucking, problems with speech or feeding, problems with sleep disordered breathing. So that's sleep apnea, restless sleep, behavioral issues. We also talk about nighttime grinding, muscle dysfunction, underuse or overuse. And we identify soft tissue problems like tonsils and adenoids. So we are all about restoring exclusive nasal breathing for our children, proper tongue resting posture, which is, by the way, tongue to the roof of your mouth for ages from 0 to 100. And as our mentor, Dr. Zaghi, says, we are all about putting out the smoke before it turns into a fire. So all in all, it's really all about coordinating a multidisciplinary care to advocate for our children. So I work with Dr. Ryan Robinson at the Pain and Sleep Center of Delaware Valley in the great little state of Delaware. And he is triple board certified in craniofacial pain, dental sleep medicine, craniofacial dental sleep medicine. And he treats adults, and I treat most of the pediatric population. So what he sees are the problems that arise later down the road when all these issues are not treated as children. So we are a multidisciplinary center that is patient-focused to help our patients breathe with purpose and thrive.
I love that. It's very.
I know it's a lot.
No, it's okay. That's what I mean. I introduced you as you have a whole plethora of just knowledge in different disciplines, and it's just been really awesome to see you develop all that over the years. So, of all the things you could share with us, you know the drill. I'm asking for just 3 tips that you can share with us. I mean, part of the reason I started the 3-tip bit was to give people just access to different knowledge and new knowledge, and maybe even some encouragement that, you know, in lots of areas of life that we can't control right now, if there are any aspects of it that we can control, let's share that. So what are the 3 tips that you brought to share with us today?
Yeah, I'd love to share 3 tips with you. So number 1 tip, is breathe through your nose. The nose is for breathing and the mouth is for eating. So you wouldn't put food up your nose, so don't breathe through your mouth, okay? It's a really simple concept, but most people do not do that. So when you breathe through your nose, you're actually getting moist, filtered air. Your sinuses are cycling it and they're creating nitric oxide. So nitric oxide is basically like super oxygen, and it is known to kill bacteria and viruses. So especially right now during this time, there is research that breathing through your nose, nitric oxide will help keep you healthy. So super important to be able to do that and to make sure that we're keeping our mouths closed, right? So when you're actually mouth breathing, most people think that you're getting more oxygen and it's better for you. It actually does, it's very counterproductive. It does the exact opposite. So it reduces the quality of oxygen that you're getting, and it reduces the amount of oxygen in your blood. So it is straight, dirty air going directly into your body. So if you remember nothing else, just breathe through your nose, okay?
Got it.
The second tip that I would recommend is actually a simple breathing exercise. And it's part of a school of breathing called Buteyko breathing. And this exercise is excellent for stress and anxiety. So we're going to do it a couple times together. All right. Now, what this type of breathing does is it restores oxygen, carbon dioxide balance with controlled breathing. When you actually, so when people say, take a deep breath, you'll feel better. It's actually counterintuitive. Taking a deep breath, you are losing more oxygen than keeping it inside your body. So this type of simple breathing is really good for all this like high anxiety and stress right now in our lives. So what I want you to do, so these are called small breath holds. So sit up straight. I'm going to talk you through this twice, okay? So sit up straight.
Should I close my eyes?
Well, everyone should be at home right now, probably by themselves. So you can do whatever you want to do.
Okay.
You won't look too weird.
Okay.
But you can sit up straight. You want to take a normal breath in and out. Now on your exhale, pinch your nose and hold for 3 to 5 seconds. 1, 2, 3, 4, 5. Now let go and breathe normally through your nose for 10 seconds. All right, now repeat. So breathe normally through your nose. Okay, exhale, pinch your nose, 3 to 5 seconds. Let go, breathe normally for 10 seconds. Okay, so you're gonna repeat this for a total of 5 to 10 minutes, and it's 3 times a day or whenever you feel stressed or anxious. So the purpose of this breathing is that you're breathing, first of all, normally, so that you're not taking a deep breath. You're breathing normally and you are breathing through your nose, okay? So you're getting the good oxygen and you're sustaining it on a normal level, so it allows for more oxygen to be in your body. So forget about the whole deep breathing thing, okay? Because it's really actually not good for you. So the third thing that I want to talk about is a call to action. So as I told you earlier, this is what I do for a living, and I really feel very strongly about it. So my call to action for you is if you, your spouse, your child, grind their teeth at night or have been told that you snore at night, it is a call to action for you to get evaluated comprehensively. So it means that you are not breathing optimally. Snoring is soft tissue collapsing and blocking the airway, while grinding is the brain telling your jaw to move to counteract soft tissue collapse. So people always, every single day I hear people saying, well, everyone snores or it's totally normal. So it's common, but it's not normal. So the bottom line is that if you have enough oxygen going to your body and to your brain, you will live a healthier and longer life. And the research shows that. There are so many things that go along with not getting optimal oxygen, a lot of health issues. So it's not just being annoying to your spouse, okay, sleeping in separate rooms. These are real issues, and they really do pertain to our daily lives. Right?
So I rarely ask, where do we go for this comprehensive, I was going to say I rarely respond with a question, but because this is such a specific call to action, where do we go to get that comprehensive evaluation?
So the first thing you could do would be to go to your state board, so your dental board. So what we do, Dr. Robinson and I, we have very specialized training in this. So you can't just go to, so most general dentists or even your pediatrician are not as highly trained as we are. So the best thing that you can do is go to, you can go to your state board, do some research on it, and you want to find dentists that are trained in myofunctional therapy. There's dental sleep medicine. So it gets a little bit complicated because there is a lot of searching to do, and you really want to find a comprehensive and multidisciplinary approach to it because it's not one size fits all. And you have to find the real deal. But
Yeah,
I'll share my website with you.
I was going to say, yeah,
bit.
please share with us how we can contact you.
So we are the painandsleepcenter.com. And on there, you will find a wealth of information. So we've really spent a lot of time developing the website. You can learn about infants, children, sleep apnea, chronic pain, all those things. And there's good resources, good links. And also my page on Instagram, Dr. Joanna Green. And then the Pain and Sleep Center on Instagram as well. So we are always posting content. So
awesome. Thank you.
Yeah.
Okay, so I'm going to do my best to recap this. So number one, breathe through your nose. Number two, go back and rewind this video and practice the Buteyko, is that right?
Buteyko breathing, yep.
Buteyko breathing, 5 to 10 minutes, 3 times a day is ideal. But Joanna did a great job walking us through that. I'm sure their website also has some great information. And then number 3 is the call to action, which is if you or your spouse or anyone else in your family, child, snores or grinds their teeth, go get a comprehensive evaluation. And the best place to do that is probably first go to your website, Joanna, but then also check with your state dental board. So, okay, so you know the drill as we wrap up here. I'm going to ask you, what is one thing that makes you really happy that you'd like to share with us?
So I was thinking about this for quite a while last night, and there's a lot of things that I could say. But I would say the most pertinent thing for me right now is really being surrounded by an amazing team. So they are what make it possible. Everything that we do, our team is what is our support, our foundation. So really, it would not be possible without them. So everyone on my team is educated. They're dedicated on continuing education and really just have a kindness to them that makes it just an amazing support system for our parents, our patients going through this journey. So especially in this time right now of uncertainty, make sure that you're treating your team well, because they're the ones that are making it possible for all of us to do what we love to do and support us and are really the backbone of what we do. So
awesome.
So that makes me happy. When my team is happy, I'm happy.
Awesome. So good. Well, listen, thanks so much for joining us. And thank you so much again for tuning in, and looking forward to continuing to provide awesome information, value, encouragement, insight that is very actionable. So tune in next time to the next 3-tip bit. See you soon.